Hello again. This is Rich B Talks Emmy. I apologise for the state of my face. I'm very, very tired today. But anyway, today's video is we're going to be talking about the diagnosis. So how chronic fatigue syndrome is kind of diagnosed and how they distinguish it between like that and other similar conditions or conditions that have a similar set of symptoms. So when I got diagnosed, they did a ton of blood tests. They did tons and tons of blood tests. They tested me for diabetes, anemia, they tested my thyroid, hormones, they tested my vitamin D and my calcium. They did a liver function test, a kidney function test. God, what else? They did a couple of other ones that I can't remember as well, but I had like bruises everywhere. I'd also recently been in hospital because I had a kidney infection, so I really felt like I was a pincushion. When I had the kidney infection, I had my blood taken out of here. They also tried here because they couldn't get it out of there originally. She had a look at this arm and just went, no, not even going to try. So she went there, and then back to there because she couldn't get out of the back of my hand. Then I had to go back the next day, and I was there like crying. I was like, oh my god, if they have to take blood out of this arm, I'm going to cry because I was so bruised because they did it so bad. But the lady got it out of this arm and did it perfectly, and I'm like, this is my bad arm. How did a magical woman? I think I actually said to her that she was a magician, or something along those lines. I was like, how did you do that? So yeah, so I had a load of blood tests and I had some, I did some urine tests as well, and I had to do some poo tests too, which is really lovely. Because they were also investigating my IBS at the time, and I had to have a really fun procedure called a colonoscopy. That was joyous. So with the colonoscopy, what they do is they give you these sachets of this really strong laxative, and it tastes nasty. It is nasty as hell, and you have to drink so much water with this stuff mixed in it, and it makes it taste of ass. Like, I'm trying to describe like what it tastes like. It's like this really weird combination of like, it's sort of sulfury and like salty, and like I tried to dilute this shit down, and that was a mistake because I then made it harder for myself to drink it because I had slightly more to drink than I should have done. And I mixed it with juice, and that sort of helped a little bit. And I was putting it in the freezer. I was like, my friend was like, seriously, put it in the freezer. And like loads of people were saying to put it in the freezer, so I did. I was like trying to cool it down as much as I could, and it tasted god awful. And I couldn't eat anything either. I couldn't have anything solid, so I was allowed to have, I think, a singular egg and a singular slice of toast for breakfast. And then for the rest of the day, I wasn't allowed anything solid. So I was allowed jelly, but I wasn't allowed red jelly because apparently that stains. So I had some lime jelly and I had some pineapple jelly. The pineapple jelly was really good, actually. I was really happy that I did that. And then I was allowed strained vegetable soup stock, so I had to get rid of all of the vegetables and just have the liquid, which surprisingly tasted alright. It actually tasted good. I was like, oh, this is quite good. I'll have this all the time. So yes, I was allowed to eat those, and I had a bit of Bovril as well. That tasted okay. I don't really like Marmite or Bovril. No, it was Marmite. It wasn't Bovril. It was Marmite, and I was like, I need something. So I needed something I don't know, strong tasting, salty, and I actually found that if I had a mouthful of Marmite and then I downed a load of my stuff, it made it a little bit better. But I felt awful because I just couldn't drink this stuff, and I ended up crying, and what it does to you is really, really disgusting. So I won't go into it that much, but you end up pissing out of your ass, basically. It's really cheery. And then you go to the hospital the next day, and then they shove the camera up, and I actually thought that was quite interesting. I'm just kind of lying there watching this screen like, ooh, that's the inside of my colon. Ooh, that's my cecum. Ooh, I know all of these things. Oh, look, you're going. And I thought it was quite interesting until they kind of... Right, so this is going to be backwards for you, so... Okay, so it's on this side of me. Yeah. So they're going up and they have to turn, right? So there's a turn that goes like that. And when they were trying to get around that corner, Jesus Christ, I was screaming, like it hurt like hell. It hurt so bad. And they're like, oh, give them more sedatives and this and that. The sedatives didn't actually kick in until halfway home. Which my partner found hilarious. So we were halfway home, then all of a sudden he said it was like I just turned drunk, like instantly. And I was so tired, and yeah, it was interesting, but it really sucked, and you just felt proper bloated for ages because they pump a load of air in you so they can see it on the screen, which is then really undignifying when you're then lying in this kind of ward afterwards. You're not wearing any underwear, you've got these really weird kind of shorts on that have a hole where your butt is. They did amuse me. I looked so sexy. So you're there and you are specifically told by your porter that you aren't allowed to leave until you pass enough gas. So you're sat there surrounded by all these people and you're just tooting away. Yeah, so that was fun. So I had like all of this going on at the same time when they were trying to figure out like what was wrong, because they didn't know what was wrong. And then yeah, they did all the blood tests and were like, oh, you have chronic fatigue syndrome. So yeah, and actually what is quite bizarre is I've gone the complete opposite way in terms of my IBS, because I used to go like all the time. This is really TMI, but we're friends here. But now, because of the medication I'm on, I just don't go out at all, and it's like, yay, great. So now I have other issues to do with that, which is really fun. So yeah, so that was my diagnosis. It was all a bit in the air and proper stressful because there were other stuff that goes on. But onto the NHS website, where it actually tells you properly how they test, and rather than just me rambling on about my diagnosis. So it can take a long time for CFS to be diagnosed. There's other conditions that cause similar conditions need to be ruled out first. That is true, and then there's also the issue that some doctors still don't believe in CFS or ME, even though it is a thing. There are still doctors out there who are like that. Twats. Anyway, you may be given some advice about managing your symptoms before a diagnosis is confirmed. I had a bit of that. If you see your GP about persistent and excessive fatigue, they'll ask you, oh dear me, about your medical history and may carry out a physical examination. They didn't really ask me for that. I was like, well, my nana has diabetes and my grandma's sort of got this and this and that, and just kind of briefly told them about that. So that's why they were like, oh yes, yeah, go, we'll test for diabetes and stuff like that. So you may have blood tests, urine tests and scans. Oh, I did have a scan. That was fun. When they were trying to figure out what was up with my kidneys, they gave me an internal ultrasound. I'll leave that to your imagination how much that sucked. They rule out other conditions such as anemia. Yeah, they checked that. And an underactive thyroid gland. They checked that. That was what I wanted. That was what I was hoping for. Not what I got. But my partner does. Really quite amusingly. Because he's asymptomatic and his leg kept twitching at night. I was like, go to the doctor, seriously, you might have restless leg syndrome. Went to the doctor's, has an underactive thyroid gland, and I was like, you fucker. That's what I wanted, because that can be treated with the pills. Mine really can't. Really, I'm still a little bit bitter about that, but it's fine. He's struggling with it because his underactive thyroid gland is proper special snowflakey. Yeah, it's quite bad actually. I do feel for him. So anyway, they'll check you for that, and they check your liver and your kidney stuff, as they did with me. So yeah. So the NICE guidelines, it says on here, doctors should consider diagnosing CFS if a person has fatigue, and all of the following apply. It is new or had a clear starting point. Mine did. Mine had a very clear starting point. It is persistent or recurrent. Yep. It is unexplained by other conditions. Yep. It substantially reduces the amount of activity someone can do. Yep. It feels worse after physical activity. Yep. The person should also have one or more of these symptoms: difficulty sleeping or insomnia, you know, muscle or joint pain without inflammation, headaches, painful lymph nodes that are not enlarged, not really, sore throat, yeah, quite a lot, poor mental function such as difficulty thinking, yep, symptoms getting worse after physical or mental exertion, yep, feeling unwell or having flu-like symptoms, yep, dizziness or nausea. Sometimes the dizziness is really annoying. Heart palpitations without heart disease. I don't get heart palpitations, but that's what they look for. The diagnosis should be confirmed by a clinician after other conditions have been ruled out. The symptoms listed above must have persisted for at least 4 months in an adult and 3 months in a young child. So if you have those symptoms for, say, 3 months and you're pretty convinced it's like CFS or post-viral syndrome, according to this, they'll be like, nah, you're fine, which I think is ridiculous, because post-viral syndrome, that can last for a shorter period of time, so I think that that's a bit rubbish. So that's what they say, and pretty much exactly the same what they say, like on the ME Association.org website. So they check for anemia, they check your white cell count. So on here it says that's a measurement of number of cells which fight off infection. This count is often increased during the early stages of infection, but as ME/CFS becomes chronic, the level usually starts to return to normal. And some people have atypical lymphocytes, like the white blood cells are a different shape, because that can happen when you've had glandular fever, and that's actually, if your glandular fever is really, really bad, they'll do a special assay, and that comes back and it'll be positive for glandular fever. But if you have a look down the microscope, you can see the different shapes of the white blood cells, and that can also be an aid in diagnosing glandular fever. Biomedical scientist. So a raised level of a type of white cell known as eosinophils can occur with allergies or when infection with Toxocara is present. Oh, I don't know what Toxocara is. I'm not going to check today, I'm too tired. So they do a acute phase protein changes thing, ESR test. Oh, so if that's raised, this suggests some form of chronic infection or inflammation. The vast majority of people with ME or CFS have a normal ESR. They do liver, thyroid and kidney function tests, and basically they're all pretty much normal. And thyroid function tests, that'll be normal. And then they will do like a urea, electrolytes, calcium, the calcium levels and stuff like that. And basically everything should be normal. Everything will be normal. You may have a raised white blood cell count, but that's it. Everything is normal. So you basically have all these needles pricked in you for them to say, everything's normal. You have a slight raised white blood cell count, which may mean that there's infection there, but essentially there's nothing wrong with you, so we're going to diagnose you with CFS. Is essentially what happens. What does this one say? Is it the same? Yeah, that's the same actually. That's nice, and they don't give you a lot of information on that thing. That's frustrating. Patient.info. This is the worst website for giving you stuff. How is chronic fatigue syndrome or ME diagnosed? There is no test that proves if you have it. A doctor will usually diagnose it based on your symptoms. Some tests are usually done to rule out other causes of your tiredness or other symptoms. For example, blood tests may be done to rule out anemia or an underactive thyroid gland and liver and kidney problems. All these tests are normal in people with CFS and ME. That's all it says. In fairness, that's it in a nutshell. So I guess they're straight to the point. This is this Mayo Clinic thing that I found yesterday, and they don't tell you any tests. They just give you the diagnostic criteria, which is loss of memory or concentration, sore throat, enlarged lymph nodes, unexplained muscle pain, pain that moves from one joint to another without swelling, headache, unrefreshing sleep, extreme exhaustion lasting more than 24 hours after physical or mental exercise, sleep disorders, chronic fatigue. So basically they rule out sleep disorders, mental problems and mental health issues, even though they can be linked. But hey, so they don't actually tell you much. They tell you a little bit about the treatments and stuff, but I'll go into that. That's next time. So that's how it's diagnosed. They basically see if you have something else, and if you don't, they go CFS. There you go, on your way. If they're good, they'll kind of refer you to a CFS clinic, like the one I go to, which is interesting, and I will talk about that another time as well. And then you get given different medications and different ways of managing it, and that's pretty much it from my experience so far. They go, off you pop, have these, good luck. And you just kind of have to do your best to try and get on with it and try and push past it and try and get your body to, you know, not be tired all the time. Which, to me, I think that they could do more. But hey. So, that's how they diagnose it. Apparently, I've seen some things about they're coming up. Well, they've been trying to find out specific tests for it, but I don't know how well they've been doing. I haven't really been able to find that much, apart from this top one, which I think is going to be a lie. Yeah, it's a lie. I knew it was a lie. Like on Google, if you put in how is CFS diagnosed, the first one is groundbreaking CFS report, and it's like, oh cool, let's have a look. Oh, you want me to pay you for things? No. So yeah, that's pretty much how you get diagnosed with it. They just test to see if you have something else wrong with you, and that's it. So yeah, this is the longest video I've ever done, and I apologise, that's really long. I'm gonna go. Okay, see you guys later, bye!